Hi, I'm Katie Allen, Mohs surgeon and partner at Premier Dermatology. This is Courtney Book, our newest Mohs surgeon. We're here to talk to you about what to expect with Mohs surgery.
So you're probably wondering what Mohs surgery is. Mohs surgery is a way of treating skin cancer. It allows us to take the smallest amount of tissue, but gives you the highest cure rate. We start by marking out the borders of what we can see on any given tumor. Then we take a layer, is what we call it, take that to the lab, they process it. We look at it under the microscope and see if there's any tumor extending to the margins of what we've taken. If there is any tumor, we're able to go back and take more only from where it's positive. If it's negative, great, we go back and we get you fixed up.
So when you're preparing to come in for your Mohs appointment, we want you to go through a few things. First is, most importantly, eat before you come. This is not a surgery that you have to be fasting for. So please eat before you come. That'll help you get through the day. Mohs surgery can last a few hours, so we do plan on having you be here for a few hours. Don't make any other appointments or plans for later in the day. That is very important. Plan on having potentially a ride to take you home. Sometimes bandages can get in the way of your visual field, so it is important that you have somebody either with you or that can be on call to take you home after. It is sometimes nice to bring things to do, like a book or a game or something to keep you busy, because there will be a lot of downtime while you are here for Mohs surgery. As Dr. Book explained, we do take that tissue back and actually process it while you're sitting here and waiting. And so it's nice to have something to do during that downtime. I also would recommend wearing comfortable clothing and things that you could layer, because our offices can get cold sometimes throughout the day. We have snacks and drinks and coffee and tea to bring for you here, but some people do go ahead and bring lunches to have with them, and just anything else that'll make you comfortable.
Mohs surgery is usually reserved for places where real estate is at a premium. So places like the face, the hands, the genitalia, or for particularly large or infiltrating tumors. If it's your time to have surgery, here's what you can expect. We'll bring you back into the room. We'll mark out the tumor like we can see it. We'll take that layer. We'll bandage you up. Then you'll go back out into the waiting room where you'll be able to have snacks and a drink if you'd like. We'll process the tissue, look at the slides under the microscope, see if everything's clear. If it isn't, we'll bring you back into the room, and then we'll take another layer. Once that's done, we'll bandage you back up, and back into the waiting room you'll go. We'll do that until it's all clear, then we'll get you fixed up.
So once your procedure is over, there are things that you can expect when you leave and go home. First, you will have a big bandage over the site. This is usually a pressure bandage and is made to keep pressure on the wound. We ask you to keep that in place for 24 to 48 hours. You can also expect the numbing medicine, unfortunately, to start to wear off. We usually recommend to take a Tylenol or an ibuprofen sometimes to help alleviate that pain as it starts to set in. Everybody's pain tolerance is a little bit different, so some people do experience a small amount of pain after their procedure and some have a larger amount of pain. If you have any concerns over this, please talk to us while you're here and we can address those concerns. You can expect when you remove the bandage at 24 to 48 hours for the site to be a little bit swollen and red. The redness comes from just the healing process itself. You get new blood flow into that area, so pink does not always mean infection, and it will stay swollen for a little while. We will go over kind of wound care with you, and you will have a sheet that you will take home that will go over those instructions in case you forget. But you usually are allowed to get that site wet after 24 to 48 hours. There are a few exceptions to that. When you get in the shower, or if you just want to wash the site, we just recommend mild soap and water, and we don't recommend that you wash it with anything other than your hands, no washcloths or anything on it. After you finish washing it, we'd recommend that you just apply a little bit of Vaseline or an antibiotic ointment if it is prescribed to the site, and then cover that site with a new bandage. And that can be sometimes as simple as 2 Band-Aids side by side if it's not very large, or usually we'll send you home with a package that'll contain wound care supplies with a little bit of nonstick gauze and tape, and we will walk you through how to apply that before you leave.
We know it can be scary to have surgery, but please rest assured that you're in the best hands possible. We really care about you having a good experience. We've both done fellowships dedicated to Mohs surgery, and we're here for you now, during the surgery and after. If you have any questions, don't hesitate to reach out. We really are committed to your health and well-being and want to know if you have any concerns.
And just remember, prior to coming, make sure you eat a good breakfast and then take any medicines that you normally take. And like Dr. Book said, we're here for you both before, after, and a lot of times we'll have you come back just to make sure you're happy with how the results have turned out.
We look forward to seeing you on your surgery day.